I am joined today, right now, with Angela and John Dayton of MedForums. I understand you're creating an educational platform, which we can get into, that really kind of pulls things together for clinicians specifically. Okay, so we like to start in our interviews to really talk about first that big passion, call them health moonshots. Kind of what's that big audacious goal that you're shooting for with MedForums?
So our moonshot is really to streamline the connection between physicians, education, and the credentialing process in order to really ease the burden associated with accessing and digesting the education that they're mandated to take advantage of. By offering a platform that really allows them the opportunity to see the informal and formal resources that are available to them, so on a daily basis, they can access what they need when they need it.
Okay. So, John, you're a physician, you're a practicing physician.
Yeah, emergency physician.
Yeah, walk through how this would make your life better.
Sure. The idea actually came out of a bad experience. I went to a board preparation course that just wasn't great. I ended up taking a lot of time off to be there, kind of opportunity cost. I ended up needing to take another course to feel like I was ready, and came away from it thinking, boy, I wish someone would have warned me. I probably should warn somebody else. Conversely, there's great stuff out there that I need to hear about, and rather than relying on a flyer in the mail or something that's elevated on Google based on the tricky words or SEO, I wanted to find a way for physicians to refer to each other the best courses.
Okay, awesome. So that's the problem. You experienced it personally. What are you building? What is MedForums?
So MedForums is truly a resource data analytics platform, really that provides social proof associated with the education that's available. There are thousands of resources available to physicians. They don't have the time to really do their own digging in on exactly what is going to work for them, so they're relying upon their peers to make those recommendations.
So is this like a Yelp for
Perfect.
CME sort of idea?
I would say it's a Yelp for medical education resources. Okay. So CME is only one part of medical education. So starting at like your first year of medical school, you have your USMLE prep that you need to do because you have tests coming up. In residency programs, you're going to have your board preparation you need to prep for so that you can pass your boards and ultimately practice medicine. Once you're practicing, not only do you have your continuing medical education, but you have your maintenance of certification, your lifelong learning skills assessment, and not to mention those daily tidbits of information in order to stay up to date. So it's more than just CME, right? It is like the Yelp for all of the medical education, informal and formal.
Okay. So you're a startup, you're getting started, tell me where you're at in 2019, coming into 2020, and what you're really excited about for the next year.
So in 2019, we are 14 months old.
Okay.
And this last year, we had over 550,000 physicians on our site.
Awesome.
With 286,000 of them being unique users.
Okay.
So we're getting a lot of traction within the physician, element. A lot of that comes from partnerships we're developing with medical schools and residency programs, specialist societies, health systems, all of those locations and organizations that our audience is part of.
Okay.
And then we started off with 368 resources that we just kind of scraped from the internet that John knew about, his colleagues knew about, and started from there.
Okay.
And we're already up over 1,600 resources by our clients that have uploaded to our platform.
Okay, awesome. I love hearing the importance of those big partnerships. That's really the theme of this festival, collaboration. So if there's one thing you're looking forward to for 2020, what's coming next? What should we be looking forward to?
Yeah, so I would say in 2020, we're excited about the pipeline of not only clients that we have, but also the partnership development with the health systems and being able to supplement their current learning management systems in order to provide access to clinicians within their clinical workflow.
I think this is your first Startup Health Festival. What's important about being at an event like this and sort of meeting the kind of people who are here?
It's great to be able to. The app's been really nice because we can say, oh, this is a healthcare system that we want to connect with, or this is a practicing physician, we'd love to get their input, and then we can see the other folks in their background, and that's been really helpful.
Awesome, awesome. All right, that's all the time we have. Thank you so much for being here, John, Angela. I love what you're building.
Thank you.
And wish you the best of luck.